The first nerve we want to describe is the lateral cutaneous nerve of the thigh. It's exactly what it says, lateral on the side, cutaneous, the skin, nerve of the thigh. And it's the nerve that supplies this area down the side of the leg and a bit right up to the top of the hip, almost to the waist. This is a very important nerve clinically because it often gets impinged right up here where it comes through under the inguinal ligament. This nerve gets impinged so often that it has its own condition named called neuralgia paresthetica. So patients complain of the pain in this lateral side of the leg. Also with surgery or low abdominal surgery, pelvic surgery, very often when the first stitch gets put in, that nerve can sometimes be entrapped in the corner suture of the wound. The important thing about this nerve is that it's a purely sensory nerve. In other words, you can stimulate it as much as you like, you're not going to get any motor twitch associated with this nerve. But you're going to have to rely on the patient giving you feedback to say that she feels the sensation going down into that area or not. Now, the way to locate that nerve, you first identify the anterior superior iliac spine, which is this little bit of bone here. And then the inguinal ligament runs from that anterior superior iliac spine down to the symphysis pubis. So it's a ligament that runs across there. The nerve comes out between the bone and that ligament. Up in the corner that's made between the bone and the ligament is where the nerve comes out. And that's where you're going to try to locate the nerve. So we'll put a little bit of conduction jelly on the tip of our probe, and we'll start on a lowish milliamps of 5, and we're going to find the nerve around about in there. And what are you feeling?
I'm feeling it going all the way down to my knee.
Right, so not below the knee. She says she's feeling it down the side of her leg, down to her knee, but not below the knee. So that's the lateral cutaneous nerve of the thigh. Very easy nerve to find, very easy to treat, and it's a nerve that very often requires treatment because it's a nerve that gets impinged or snared in a suture.